Hello, faculty and staff of Georgetown University. My name is Latanya Whitaker. I have been a registered nurse for 3 years now. I obtained my undergraduate degree from Chamberlain College of Nursing in 2012, and I graduated with presidential honors. It is my pleasure to introduce myself to you all and to also let you know why I have chosen to further my education to obtain my master's degree in nursing with a concentration in family nurse practitioner. In 1994, I had the opportunity to meet some magnificent nurses. My grandfather fell ill and he was in the intensive care unit for 6 months. And I watched those nurses daily dedicate themselves selflessly to providing care and love to the patients and the families of that unit. I realized at that moment that I wanted to give myself back to others as well in that same way, and so that's why I chose to become a nurse. In 1998, I started my career as an LPN. Throughout my nursing career as an LPN, I was able to work in family care practices, pediatric care units. I worked in the urgent care setting, the emergency room. I worked in geriatric long-term care, and I also worked in the psychiatric departments. Being a patient advocate has always been a true passion for me because I have learned that through being an advocate for patients, I am able to help them obtain the best quality care they can obtain by being their voice. I have learned through communicating with my other healthcare members that we can provide quality care with dedication and time. I have learned that it's very important for us to work together for the better well-being of these patients. I also know that that's the reason why I want to be a family nurse practitioner, because I want to be able to integrate all well-beings of the healthcare setting, from the physical to the mental to the emotional to the spiritual and to the social. I know that through educating my patients and through the intellect that I will learn from going to Georgetown, that I will be able to give them the best knowledge and I will be well prepared for the clinical setting. I know from reading your mission where you want to educate women and men to be lifelong learners and that you want them to be able to give their civic duty to everyone, that is something that I hold within my heart. I want to be able to touch everyone's lives. I want to be able to educate them to the highest that they can be educated, because patient education is very, very important. I know that disease and sickness has no age. From experiencing my grandfather being sick to experiencing my 2-year-old being diagnosed with cancer. I have educated myself on health and well-being and nutrition to the point where now I am able to educate my other fellow staff members as well as patients that I encounter and parents that I have encountered being through this journey that I have obtained through my being with my son while he's been sick. It's so very important to me to be able to educate patients on the importance of health and nutrition to maintain and sustain their health. I want to be able to educate them so that we can decrease these fatal diseases such as heart disease and cancer and diabetes and HIV and AIDS. I want to be able to let them know everything that I could possibly let them know from the knowledge that I'm able to obtain and the clinical experiences that I'm able to do. Through learning these experiences and gaining this information, I will be able to help someone else and save their lives. That is so important to me. So by being a family nurse practitioner, I will be able to touch people of all ages, which is important to me. I want to touch them and to help them live their life to the best quality that they can, and to let them know that through education and communication and through treatment that we can conquer this thing called health. I want them to let them know that educating themselves and being able to know the questions to ask and the things to look for, the symptoms and the risk factors that we encounter every day in our life, they're very important to our health. So through the education that I would learn through Georgetown and becoming a family nurse practitioner, I will be able to touch lives and I will be able to help when it comes to sustaining and maintaining health of individuals of all ages. I know that we can do this. I want to learn more so that I can prepare myself. I want to know that the education that I learned from Georgetown will not only help me, but it will benefit my patients. So thank you for your time, and I thank you for your consideration. And I look forward to becoming a part of such a prestigious institute, and that you guys offer the best education there is, from me personally learning from my clinical experiences, from learning through my fellow classmates, from learning through my professors. I know that we can conquer disease, and I know that we can make this world healthier together. So thank you for your time once again, and God bless.